Okay, hello everyone. Dr. Rich Castellano here, the Smile Doctor. We're here today with Nala. Nala, thank you very much for allowing us to share your video and do teaching with doctors and our patients and students. How are you feeling? You feel that relaxing medicine settling in?
Yeah, I'm doing good.
Yep, I feel pretty relaxed too. And we did the numbing for Nala. If you look, you can see how the epinephrine causes a little lightness of the skin. And Nala was saying, she's like, I'm very sensitive, but we did the numbing and she did very, very well. How was the numbing? Did you feel much of the numbing, Nala?
Very little.
She felt very little. Now, here's what we're doing for Nala today. We're doing the lift of the neck and the jawline. Were you at one of our seminars, Nala?
No.
Or you just came through the office? So she came for a consultation and you got a chance to read some of our book.
Yes.
And was that helpful to go through the book?
Yes, just all your expertise and all the women, how much they love you and how much better they feel about themselves.
You're so sweet. Well, it's an honor to take care of you and really excited. We're getting things set up here, so I'm just going to do my little zoom in for each one of our feeds. We're on Facebook Live. We're on, you can go ahead and grab the garbage can, get that out of the way. YouTube Live and on Instagram Live, so you can follow us on Instagram, Image Lift Now. Yeah, you can set that over here already is right. It's going to actually go right over there. It's perfect. Thank you. Facebook.com/Image Lift. So we've done the numbing, so we'll get started. We're also doing some of the laser lipolysis. Now the laser lipolysis will remove some of the fatty tissue, and then it also tightens the skin. It creates a thermal injury under the skin. So now that we have everything is all set up for us, make sure you are following, and also make sure you share with your family or friends, because they're going to want to know, did you get that shot, Alex? That you're watching live procedure. And that way, when you tell them, they're not going to get upset saying, well, you should have told me.
And as many as your videos that I watched, that gave me a lot of confidence too.
So yeah, Nala got to watch a lot of those videos. So that was that helpful when you saw the videos and then when you met our team? You said it made you feel like you knew us already?
Yes, and watching the videos, just how no one cringed, no one jumped. Everybody looked like they were pain-free.
Right, that's our job, is make sure you feel comfortable. Now if somebody feels a pinch, I'm going to take care of that. We'll do the numbing very quickly, but that way it's all about your comfort level. If you don't feel comfortable, I don't feel comfortable. And after doing this for 4,000 procedures under local anesthesia, you know, it's pretty clear that you don't need general anesthesia, you don't need IV sedation to have these treatments done. So did you get what you need, Alex? Mm-hmm. Okay, great, as long as you have what you need. I'm going to have you turn your chin all the way up. And so what we're going to do now, we've marked things out. We've already done the numbing medicine. Thank you all for watching. Thank you for sharing. So we'll make the little incision, and this is the 15. So that's the 15 that allows us to make the skin incision, and as you can see, there's really very little significant bleeding. And I use the bipolar cautery just to seal the blood vessels. You would turn that on. Yes. Thank you. So I like to use bipolar cautery here, and you have the eye shield. We're going to put these little eye shields over top. So your job is to keep your eyes closed, Nala, number 1. Number 2, we put the eye shields. Number 3, I only activate that laser when it's in a safe place to do so. And we have an outside consulting firm. They monitor all of our practices, making sure that we are always raising our safety standards. Thank you to Universal Healthcare Consulting. And also, Nala, have you used Arnica montana before?
No.
So Arnica montana is an herbal medicine, as many of you know, and the research has shown that it's proven to decrease bruising and swelling. Did you get what you needed? Okay, great. And we have the Arnica patches. So that's the Acumen by Sierra. So we will be putting some patches on at the end when we're done and giving you some patches to go home with. That'll help reduce your swelling and bruising. So I know that will be a good thing for you. Now, once we have this all set up, so we've done a little bit of cautery, we make the little incision. So now, this is the laser lipolysis with the Cynosure triplex machine. It has a 1064-1320 wavelength ND YAG laser. This is the helium neon guiding beam. You see the red there, so you can see there's a little fiber optic that goes through the metal sheath, the cannula. And so we just insert here, and then I depress the foot pedal, and you hear a little popping noise. So this is the laser lipolysis. It is breaking up the fat cells and it creates a thermal injury under the skin that helps contract the skin. Scar tissue contracts. Nala, are you feeling okay, dear? Everything's looking good. You're gonna love it. I always like to check in on patients, make sure they're doing fine. We monitor blood pressure, we monitor heart rate, and we also monitor the oxygenation and the patient. If just ask Nala how she's feeling. If she tells us she's feeling fine, that's the most important vital sign of all. So, under the skin, this is in the subcutaneous plane. You can do laser lifting alone. It does a good job, but it certainly does not compare with the results that you can achieve with the lift, the image lift. For those of you who are interested in the pricing, you can go to imagelift.com/pricing and come to one of our events, imagelift.com/events, and you can see, meet our patients, meet our team, get a free copy of the book. Our books have both hit the Wall Street Journal bestseller list. We're very proud of them. Now, for the physicians and students that are watching, we have our big event coming up October 18, 19, 20. That's in the Tampa Convention Center. Mark your calendar. You can go to practiceprofitabilitymd.com and see how we teach other doctors, how successful we are, how did we create that, what are our systems, how do we train the team, so that you can all improve your patient care. Those are CECME courses that you can take with us, and we show you firsthand how we get high satisfaction rates, great reviews online. You researched us online before, Nala?
I just saw y'all over Facebook.
Just the Facebook was the primary thing that you saw. And you know, the Facebook feed has been very powerful. Patients really tell us, wow, it's been such a good education to see that. And you can tell someone something, they can read up on it, but there's still nothing quite like actually seeing the procedure.
And YouTube, I watch you on YouTube.
You watch the YouTube. Okay, good. Yeah, good. You checked us out. Nobody does anything nowadays without going online to check it out. It's like online training wheels before we go do the real thing. Everything's looking good. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Everything's looking good here. We're doing an image lift, facelift under local anesthesia. It is not a traditional facelift. Nowadays, people are saying no to traditional facelifts. Oh, hi, Dana. Thanks for watching. So we're doing an image lift, facelift under local anesthesia to tighten up the neck and the jawline. This is the laser lipolysis that we're doing. And what I use is just a very light technique in the subcutaneous area. It helps to elevate the skin flap, it removes some of the fatty tissue, and it tightens the skin by creating a thermal injury, temperature please, underneath the skin. Now I monitor the energy we deliver. Okay. And we also monitor the external temperature, and I can feel it with my fingers as well. So that gives us a combination of what we can expect for the energy that's delivered. We're very proud to use the latest technology to achieve our results, and patients just don't want a traditional lift. They don't want surgical drains. They don't want surgical staples. We do eyelid treatments. We also do a lot of filler treatments, and we're excited about the arnica patches that we use. They do reduce swelling and bruising, and people have been using arnica for years and years, but now you have the transcutaneous patches, which are very high satisfaction. Our patients really enjoy the arnica patches. So thank you for watching. Thank you for your comments and questions. A lot of patients asking us about pricing. You can go to imagelift.com/pricing to learn about that. There are other treatment options as far as radio frequency, there's ultrasound, and those treatments can work. Temperature, please. But you just have to be prepared that sometimes you can do a treatment like that and spend thousands of dollars, right? Can you show me the highest is right there? Okay. And you may get little or no results. So if you know that going into it and you say, well, this is the best that I can do with a non-invasive treatment, and if you need more, you do a procedure like what we're doing today, then that's fine. But you don't want to be a patient that spends the money and says, well, if I didn't know and I wasn't get much result, I would have done something more. So what we're doing today is we tighten the muscle in addition to tightening the skin, and that is what's the difference in what we do. For the minimally invasive treatments, sometimes we say the biggest side effect is eye strain, because you're straining your eyes looking at the before and after pictures, trying to figure out what happened. You're definitely going to see a result from what we're doing. Show me the highest you got right here. Everything's looking good. Thank you for watching. Thank you for sharing. Okay. So again, the laser lipolysis creates a thermal injury, removes some of the fatty tissue, and it does lift up the skin a little bit, helps with hemostasis. That's the fancy word for making sure the bleeding is under control. Everything's looking good. How are you feeling, Nala?
Fine.
So Nala has had some of the relaxing medicine. A lot of people will say, well, my goodness, how is she awake? How is she awake? Because once you take the relaxing medicine, you feel comfortable. And we've done numbing all through this area. So she's had the lidocaine. Thank goodness for lidocaine. For the physicians and students that are watching, the lidocaine, it blocks the sodium potassium channels that basically make the nerves inactive until about an hour afterwards. Very good. Thank you for watching. Thank you for sharing. We will be doing the lifting procedure, so make sure you're following so that you get the video updates. Temperature over here, please. We monitor the temperature from the skin. We also monitor the laser energy we deliver, and I can feel the temperature with my fingers right here. We'll be in New Orleans. If you're a plastic surgeon at the ASAPS meeting, please look us up. We will be on Friday, May 17th, delivering our practice profitability, helping our doctors get a profit lift. Everything's looking good. And we'll be doing live video interviews there as well. Perfect. Okay, so we're all done with that. Perfect.
It almost felt like I was getting my teeth cleaned,
Just felt like you're getting your teeth cleaned, huh?
like a scraping. I can't talk.
Yeah, she won't. The talking is going to be a little goofy because of the numbing medicine. So now I use the Cons facelift scissors. Hi, Maggie. Thanks for joining. Yes, we're doing under the chin, but we're also doing around the ear. So now, just elevating subcutaneous. It opens up very nicely. This is my left-handed dissection. I operate with both left and right hands. It gives me a little more versatility and ease of access from different angles. When you do enough of these lifts, I basically just trained both of my hands to do the procedure. It's like playing piano. You can move, you can play with both hands. So I think it's definitely a big advantage, and when I'm in other areas of the lift, I'll use my right hand. Everything's looking good. Thank you for watching, and please do share and follow because we will be rebroadcasting later. So you want to make sure that you are following so you get the updates. And a lot of likes and shares for Nala as well. She was so kind to let us share and teach from her procedure because this is how she learned. This was what helped her decide. Before you saw our videos, were you thinking about having something done, Nala?
Just off and on.
Off and on. When she saw the videos and then she saw how comfortable our patients felt and she saw our results, she said, this is something I want to do. Now, I like to see patients in follow-up. I'll call them the night of just to check and make sure they're doing fine. I'll see them 1 day, 1 week, 1 month later. They can come to the office as often as they like, but most patients are comfortable just resting at home. Exposure for me, please. And that way we'll show them how to do the wound care. We'll put a wrap on and go through all of the details with them. Now, you'll see a bright light here.
I know everything you're doing.
You know everything. That's right. Well, that's good. If she's more informed, patients are better.
My fat out now.
That's right. She knew. You reading my mind. And so, now, Nala, will you watch your video later, do you think?
Probably.
Yeah, we're doing a facelift under local anesthesia, and we are removing some of the fatty tissue as well. Thank you, Tanya, for your comment, and thank you for watching. If you feel any pinching there, you let me know.
Mm-hmm.
When it's more predictable for patients, they appreciate that. Thank you, Alex. Appreciate that. And send me some of those pictures. Thanks.
Dr. Rich, a common question we've been getting is what does double board certified mean?
Yeah, and so people that ask what does double board certified mean is, so I did my training in head and neck surgery and facial plastic and reconstructive surgery. So I have a board certification in head and neck surgery, and I have a second board certification in facial plastic surgery. Thank you for watching. Thank you for sharing. Hello, Carmen. Hello, Darlene. So to get that board certification, you basically have to apply for it, be in good standing with the board.
I feel a little pain
Feel
on the left side.
So she feels a little. So then what I do is I'm going to do some numbing medicine. Is that, you feel it a little bit over here in that area?
Mm-hmm.
Okay, it's going to go in just a little bit. Okay, perfect. Thank you for telling me that. And if you still feel that in just a little bit, let me know. I'll put a little more numbing medicine. Okay, very good. And so you sit for their board, you submit case logs as well, and you recertify now every 10 years. So I did recertify for my boards. It's been 20 years since I graduated from my medical school. People say, well, you don't look old enough to have done 4,000 facelifts. I'm actually 85 years old, but I've done a lot of cosmetic treatments myself. Thank you for the question, Trishan. Now, some people, she said, some people may bleed more than others. Yeah, some people are on blood thinners, and everybody's a little different with that. But when we use the tumescent solution, it has a little epinephrine in it, and that helps to create vasoconstriction, which is the fancy word for the blood vessels are shrinking or constricting. That means less blood flow to the area. That also means that the lidocaine will stay and last a little bit longer. Thank you for your question, and thank you for the comments. Thank you, Deborah. Thank you for watching. Appreciate you. It is pretty amazing. Nala, how are you feeling, dear?
Okay.
You still feel sore over on this side?
A little like under my chin.
Under the chin. So here's now what I'm going to do is I'll just do right in this area. You feel a little pinching here?
Mm-hmm.
So she feels a little there. That's the spot. So I'll just do a little extra numbing, and she'll feel that go away very quickly. Perfect. Very good. Okay. Thank you for watching. Thank you for sharing. So I'm trimming. This is liposculpting, where I'm basically trimming the fat tissue directly from the neck. We did the lipo laser lipolysis, which does remove some of the fatty tissue and also separates the skin from the underlying structures. The SMAS envelopes the platysma muscle and the facial musculars. And through traction and counter traction, then I am exposing the fatty tissue beneath. Perfect. I grab it with the Brown Adsons, and then I just trim it right off of the platysma muscle. We'll look on this side. Thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're in Tampa and the Villages, Florida. Nala was interested in tightening her neck and jawline. Nala, can we share with them how young you are, dear?
Mm-hmm. 60.
60 years old. So she still has many active years ahead of her. And patients today, they don't want to wait until they have a lot of advanced staging changes. They're doing things earlier. People ask me, what's the right time to do a cosmetic treatment? So the answer is if you see something that you want to address, the sooner you do it, the better the result, the longer it lasts. So you don't have to wait until you have a lot of changes. People think, well, I'll get more bang for my buck. It's better to be preventative. And the other question is how good of a result do you want? If you want a better result, we start earlier, and we have combination treatments that we offer. Hi, Carmen. Thanks for watching. And, that brings up a good point. This is not for everyone, right? Some people will say, nope, no thanks, that's not for me. And that's great. That's why we show the videos. So you can say, yeah, I would love to do that. Or you say, nope, no thank you. I'll do fillers. I'll do something else. And it's very educational that way, whether it's something that's right for you or whether it's not. Now you know. So thank you for watching. Appreciate that. If you're not on Instagram, if you don't follow us on Instagram, make sure you follow us Image Lift now. And if you're not there on Facebook yet, go to facebook.com/Image Lift. Now, since I've done some of the trimming of the fatty tissue, now I do a corset platysmoplasty. So this is a 2O Merceline, or we also call it Ethibond suture. And it is a surgical polyester that gets covered by the scar tissue. It brings the platysma muscles together and gets more contouring under the chin. People want the best contouring as possible. There is a hyoid bone. That is the uppermost limit that we can lift the profile to. There are some doctors that remove muscles and glands in the neck to get a sharper profile. And most of my patients don't really want that. It gets a little extreme or severe because you can look skeletonized or over resected. So better to come back another day and do more rather than go too far. Everything's looking good. Hi Gail, thanks for watching. Hi Trishann. Yes, we're going to do the stitches behind the ear, and we're doing a facelift under local anesthesia. Thank you both for your comments, and thank you for watching. Only see the first part of your comment, Trishann. I don't see the second part after. Yeah, it does require stitches in front and behind the ears, but most people don't see them because they fade and they're very difficult to see. Very good. Thank you for watching. Thank you for sharing. If you're interested in the pricing, you go to imagelift.com/pricing. We use the Build My Body price estimator. Thank you to Jonathan Kaplan, and make note on your calendar, October 18, 19, 20. That's our practice profitability event for doctors and students to get CECME credit in the Tampa Convention Center. Perfect. All right. Hi Cheryl, thank you for watching. Yeah, we'll get you in as soon as we can. We do have a wait list to get patients in. Nala, how are you feeling, dear?
Good.
Are you feeling any pain at all?
No, I just feel it getting tighter.
You'll feel it get tighter. That's what we're here for. You are gonna
Oh, yeah.
love your neckline. You're gonna get the neckline of a 30-year-old here. It really looks amazing. So proud. Thank you for watching, Penny. Make sure you're following, and thank you for the shares, because your friends are gonna get upset if you tell them you were watching live surgery but you didn't share it with them. So make sure you're sharing. And thank you for the likes and the comments as well. We have our seminars and our events. We had a wonderful event yesterday. People come out from all over Florida and across the United States and even internationally. We had another fly-in patient who came in today for a consult. Very good. So now I'm stitching for the platysmoplasty, just tying the knot. We're using a 2O Ethibond for the physicians and students that are watching. And you can see all the fatty tissue we've gotten removed here. We figured that Nala does not want that anymore, so
How much?
just enough, but not too much. If you decide you want to watch your procedure later, then when you go to this part in the video, you'll see, here it is. It's a fair bit of we just remove all that fatty tissue there, okay? So we'll get rid of that. And then I'll do a little bit more trimming. I call it liposculpture. Perfect. Thank you. And thank you to Ari and Charlene and Nina. They have everything set up perfectly for me. We have such a wonderful team. I feel so much love in the office every day, and so will you, because our team really is wonderful. I couldn't do it without them.
Thank you.
Thank you guys. Really appreciate that.
We appreciate you too, Dr. Rich.
It's my pleasure. We're all in this together. Okay. Hello, Nina. Oh, thank you, Trishan. Oh, so glad that you could meet us, and I really appreciate you watching and your comments, and we're excited to help you with your goals. Okay, so we've done the corset platysmoplasty. I'm just trimming a little bit of the fatty tissue here. Perfect. So that part looks really great. Very good. And when I tuck gauze in that area, it gives me a little bit of exposure. It shows me if there's a little vein or a blood vessel that needs to be cauterized. So as you can see, there's really minimal bleeding, and I see there's just a little vein here, so I'll just cauterize that. I can see it very clearly, and you can be very precise with what you're doing here. And I'll have doctors tell me, they're like, well, how do you tighten up in the neck and do all that all under local anesthesia? And you're looking at it right now. And sometimes you may need to numb a little bit more, and that's fine. But you don't need general anesthesia. You don't need IV sedation. And most patients don't want it because they don't want to put that in their system. And some patients, once they do the treatment, they'll remember nothing. And some of them, they talk the whole way through, and as long as they feel comfortable, that's what matters most. And we frequently check in. Nala, how are you feeling, dear?
Good.
Okay, release for me, please. Now I can see the contour in her neck right now. Look at the jawline and where that is. And then we showed you in the before picture. You can scroll back to the before. We'll show you again when we're done. But looking really good. We're ahead of the game. You're going to love your new neckline and jawline. So now we're going to do some tightening from the side. So I'll turn this away here.
Can I have another pill?
Yeah, we'll give you one more. And so go ahead, Ari. You can take your gloves off.
Okay.
And so what we do is when patients take another tablet during the procedure, you just can drop a little tablet and you can drizzle a little water in, and they can just swallow it even while they're laying back because it's just a small amount. And some patients may say, well, wait a minute, can I do that? And they can always do it. Open rule, this is a half tablet, yeah. A half tablet or a full tablet? Full tablet, okay, full tablet's fine.
Okay, open a little bit more.
And we monitor blood pressure, we monitor heart rate. If you chew it up, it takes effect a little more quickly. There you go, everything's looking good. And then open your mouth real wide, and then we'll drizzle in. There's a little bit of water. Okay, that's good. You want one more sip to get it down? Mm-hmm. Okay, open real wide. There we go. Did I get it down? Okay. So we keep it that simple. If a patient needs another relaxing tablet, I'm going to turn your head all the way to the side.
I'm just nervous right now.
If she feels a little nervous. Also with the numbing medicine, you might feel a little bit of the adrenaline, and that feels some of that. So then we just give the Valium, and she'll do just fine. And so Nala, do you have any books or movies you're going to get into while you're relaxing at home?
Of course.
What kind of things are you going to get into?
Whatever I can find.
Do you normally watch Netflix, or what do you like to watch?
Romance.
Oh, the romance. Okay, very good. Do you like the Hallmark Channel?
I do. Lifetime.
There you go. Okay. The programming is too good. There's so many things that we can watch nowadays. It's too addicting. I can't stop. So I have to be careful what I watch. Are you feeling any discomfort at all?
Mm-mm.
Okay, everything's looking good.
Did you cut?
Oh, I would never do something like that. I'm lifting the skin. Very good. Perfect. Okay, can you hold the ear forward for me? So you feel a little pressure on your ear, then traction from the ear, counter traction with my forceps here, and as I pull that apart, it allows me to very easily get into the correct plane. subcutaneous plane, very easy to expose. And Nala, are you feeling any discomfort at all, dear?
Mm-mm.
Okay, perfect. So she's taken some of the relaxing medicine, and she'll either maybe drift off, or if we need to give her more, we can, but usually the relaxing pain pills, they always do a great job. But some will need a little more, or some take less, and I have had some patients that don't take any of the Valium at all. That's not typical, but every person's a little bit different. So now I'm using the bipolar electrical cautery. Okay, starts to look like, yeah, the sagging. Thank you for your comments, Alicia and Tanya. So some of our people are getting sound. You might just need to restart your feed, or check your signal where you are, because we are giving sound. Very good. Thank you for watching. Thank you for sharing. Yeah, somebody said that we can start to look like we have the turkey neck, and that's what this is best for, is when we tighten up the neck and the jawline. That's what we do best. Very good. Okay. 15, yep. Nala, how are you feeling, dear?
Good.
Everything's looking good. Are you feeling any discomfort at all?
No.
Okay, good. And that's our goal, that patients don't feel any discomfort. If they feel a pinch, we numb it very quickly, and then they feel comfortable. And they know that we're there, but they can't really tell what I'm doing. But Nala has seen so many of our videos, she said she does know what we're doing. So she's watched it. But the more educated your patients are, the better they're going to do. They're more informed, their expectations are better set. So that's our job, is to help educate and let people know what is possible.
You're gonna see the inside of my face.
We're gonna see right in front of the ear, under the skin. Some people say, are you taking my ear off? And the answer is no, we don't take the ear off. We leave the ear where it is, but we lift the skin around it and do the tightening around it. Very good. I see a little tiny vein there, so we do some cautery right in this area as well. And the superficial temporal artery is here. And every now and then we may tie that off if you come across that. Now, thank you for watching. Thank you for sharing. Appreciate that. Someone said, so let me ask you a question. Do you feel that relaxing medicine, Nala?
I'm good.
She feels good. Someone said they want to be under general anesthesia, that this is too scary. But if you want general, I mean, you can certainly do it, but it's just not necessary, because if you can feel comfortable and do the procedure.
If I could do it, anybody can. I have anxiety.
Yeah, so now normally you have anxiety, you take relaxing medicine every now and then, just as a baseline. And so you say, if you can do it, anyone can do it. Yeah, I have so many patients that tell me, oh, I'm such a scaredy cat, I can't do it, I'm afraid of needles. I had one patient come in and tell me that she's so afraid of needles, and she did a lift with us. She says, I didn't feel a thing, I don't know how I did it. She's like, I don't know how you did it, but she's like, I was fine, I didn't feel a thing. And she's not good with needles. My wife is also no good with needles. She doesn't like it, it makes her upset when she gets her blood drawn. And we do her fillers, and of course I got to do a great job for her, she's my wife. She's so beautiful, she doesn't need any treatments, but if she wants something, I'll take care of her. So everything's looking good. Perfect. So you can see how we're lifting the skin. Lift the ear for me. Thank you. Thank you for watching. Thank you for sharing. We're on youtube.com/ImageLift and on Instagram, ImageLift Now. Perfect. Thank goodness for modern technology. You used to have to go to the universities to watch this type of procedure live. Now remember, this is live. There's no editing, there's no filters, there's no Photoshop or anything like that. This what you see is what you get. So we obviously feel very confident about what we're doing, and we love doing our teaching for what we do. We were in Austin recently, did a conference out there, and we'll be in Vegas in July at the Wynn Hotel. And we'll be at the New Orleans Convention Center in the middle of this month. Very good. Everything's going really well. Thank you for watching. Thank you for sharing. Expose for me, please. So now that we've lifted the skin, I'll use the bipolar cautery again. And just a little cautery. It looks nice and dry, which is the way we like it. I'm going to bring a little bit of light in here. Perfect. And thank you, Ari. She has everything set up perfectly, makes it very easy for me. Now, there are 4 general things we do to our face to improve the appearance. If we sag, then we tighten. Behind the ear for me, please. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin. We can polish and repair the skin. And then the 4th category is better than all the others, and that's our behavior. Nothing looks as good as Mother Nature's free facelift, our smile. Nala knows the power of smile. Nala, where do you feel you get your smile from? Were your family big smilers, or sometimes we go through tough times and we realize how good we have it?
My kids and my granddaughter.
Oh, that's sweet. Yeah, you have a 6-year-old granddaughter.
Mm-hmm.
Boy, they're lucky to have you. So the 4 things we do to our face: if we sag, we tighten; if we lose volume, we fill; sun damage to the skin, we polish and repair the skin. And then the smile and our behavior is always what looks best. There are 4 principles for good plastic surgery. Safety first. You must look natural. Prevent future aging changes. And let's get as much improvement as possible. Those are the 4 things for good plastic surgery. We can't make things perfect. I never use the words gone, take away, or get rid of. You want to make them better, enhance. And you know, we never see ourselves the way that other people see us. Isn't that interesting? I mean, it really is fascinating because we're all looking at the same thing, so it appears. But the reason why we don't see ourselves the way that others do is because when we look at other people, we do it differently than when we look at ourselves. We physically glance at other people, and we're social, which means we move our face. So we glance and we're social. Hi, Carmen. Thanks for watching. Yeah, give us a call. You can call us 813-463-9245 or send us a message, imagelift.com. So physically, we glance at others when we're looking at other people. But when we look at ourselves, we don't glance. We stare and we glare. And we are critical and serious. So if you stare and glare at anyone and you're critical and serious, they're going to put a hand in your face. Or one of my patients said they're going to put a fist in your face, right? Nobody wants you to look at them like that. And we should not stare and glare at other people in a critical manner. So we shouldn't do that to ourselves either. We should not stare and glare at ourselves in a critical manner. I never look at myself unless I'm smiling. Anytime you stare and glare in a critical manner, automatically it's likely to make you feel not good. So don't do it. Oh, thank you. Tightening things up, yep. Hi, Sarah, thank you for watching. Muchas gracias. You feel it's tight? That is gonna relax. Are you feeling any pain at all? Okay, good. Everything's looking good. Muchas gracias, Sara, para mirar el video. Hablemos español también. Okay, so now I'm using the 4. Yeah, we'll need to change size. We'll need another. I like to use the 2.0 Vicryl, which lasts about 4 to 8 weeks. Very good. And that's for the preauricular mass plication. I've done plication, I've done imbrication. I'll do what I think is most suitable for the patient and the treatment that we talk about. The primary goal is patients want to look and feel their best. They don't want traditional facelifts. They're very happy with the results that they achieve here. If they feel they need to come back another day and do more, that's always better than going too far, because nobody wants to look unnatural or overdone. Very good. Very good. Hello, Saralina. Muchas gracias para mirar the video. Perfect. So I tighten that down, then we flash the suture for the students and physicians that are watching, and that allows us to keep the tension while I cinch down the knot. So that knot is under tension, it tightens things up, and when I move it back and forth like this, I'm cinching down the knot. I throw it down, as surgeons throw down, make a loop, grab the suture, throw it down, and then back and forth to cinch it down, make sure that is a very tight knot. Okay, clear the field here. I'll give that back to you.
Yes.
Hi, Saralina. You say you're thinking about it. Well, give us a call. We can help you decide what is right for you, or definitely get a copy of our book. Hit the Wall Street Journal bestseller list. It's on Amazon.com, or give us a call. We're happy to mail it out to you. Everything's looking good. So now that I've done the tightening, I just elevate and undermine the skin just a little bit. And see the extra skin here? So now, Penny, thank you, Penny, for your comment and question. So I'm going to take all this extra skin. She asked about the bruising. Some have little or no bruising, and some have a lot. We're going to use the arnica patches from Sierra Acumen. Thank you, Sierra, for providing the patches so that we can use those for our patients. And it delivers the arnica montana transcutaneously. There's another herbal element in there as well. Perfect. And so now you see the tip of the earlobe. Measure twice, cut once, and I am measuring out and trimming that area off. This is the postauricular portion, so we'll take that skin, and as you can see, there's plenty of excess. Very good. Release for me, please. Perfect. Okay, so yes, we have special patches for bruise reduction. That's called the Acumen by Sierra. And they were kind enough to provide patches for us for this video. We do appreciate that. People have been using arnica for a long, long time. We've been getting really great results with the arnica patches. Patients love that. There's no doubt that they work. The research already has been done. It's just a simpler way to deliver the product to the skin directly to the area that's healing. I got you twice. And you don't have to take a pill. Behind the ear for me, please. Everything's looking good. Thank you for watching. Thank you for sharing. Okay. Perfect. We'll need some of the arnica patches too.
Absolutely.
And wrap. We got the wrap, so thank you for bringing the arnica patches. Okay, so now, and I need another Marceline.
Okay. Yeah, at the bottom.
Release, please. So now I'm going to do some stitches. So when I do the stitches, I'll use the deep stitch. This is the 2-0. Hi, Donna. Happy to help. Give us a call. Oh, thank you very much. Muchas gracias, Doris, para tu palabras. Okay, thank you for your words. So let's see here. Hold that for me, please. A little bit, tiny bit more cautery. Perfect. I'll take this. So then, this is a deep stitch, goes into the dermis. Deep means that the knot is on the bottom part, so it's not near the surface of the skin. And when you do the deep stitch correctly, the skin edges come together. You almost don't even need a superficial stitch to close it, because the deep stitches do it all. So it's belt and suspenders. See how nice and close that comes together. That's the #1 determinant on how well a skin incision will look when it heals, is how close together are the wound edges. So that brings things together very nicely, and we are going to do another stitch to bring the skin together even more closely. So another deep stitch. Perfect. Nala, how are you feeling, dear?
Good.
Are you feeling any discomfort at all?
None.
Everything's looking good. You feel that relaxing medicine?
Yeah, I'm good.
Okay, if you think you need more, you let me know.
No.
But even people that tell me, they say, if I feel a little anxious, we give them the relaxing medicine, they do so well. And afterwards, they'll consistently say, wow, it was easier than what I thought it was going to be. That's a very consistent thing that people will say. That's why we show the videos, so you can have a good idea of what it can be like for you. Everyone is different. Okay, so a little more cautery. For the physicians and students that are watching, make sure you mark your calendars, October 18, 19, 20. Practice Profitability, where you get CE, CME credit for learning how we run our office. This is another deep stitch that I'm placing here. Perfect. For the physicians and students that are watching as well, I use a 5-0 chromic to help with the skin, because that is a dissolvable stitch and patients appreciate it if you can avoid suture removal, because it can be uncomfortable to take stitches out. So we just put dissolvable stitches, and it's highly desirable. Okay, thank you for your comments. Muchas gracias, Sarah. Perfect. Okay, very good. So now those skin edges are together, and we're going to do that extra little chromic to just bring things where we want them to be. Here you go. And then we reshape the tragus here. Now the tragus, there's some fatty tissue, so we thin that out so that it sits nicely. The tragus is Latin word root for like billy goat's chin, like goat. And that's right in front of the ear. And then this is the antitragus and the intertragal incisura, as it is called. So now this is the 5-0 chromic. I must have thrown about 1 million stitches in my career, and just a little stitch here and there. Each of these stitches are approximately anywhere from 2 to 4 millimeters spaced apart. No, yeah, okay. So, Nala, how are you feeling, dear?
Good.
Everything's looking good. So this one is about 3 millimeters apart. So every 3, 4 millimeters, sometimes 2 millimeters, it just depends on the tension on the wound. About 3, 4 millimeters apart. My version of a little microsurgery. There's microsurgery where you use a microscope, but I just get these skin edges together as closely as humanly possible. And thank you for watching, thank you for sharing, and thank you to Nala for allowing us to share your video. A lot of comments here, and people really appreciate you letting them watch. Very good. I can only imagine in 5 or 10 years it'll be the virtual reality and you'll just feel like you're really there. But this is the next step to it. Who would have thought we would have been able to do these things, but it's just so remarkable. Truly an honor to be alive and witness this technological revolution. And I got to talk to one of my friends today who, unfortunately, they have liver cancer, but I saw them and they gained 30 pounds. So they're getting treatment over at the Moffitt and doing a new treatment that they put this little patch on where it boosts their white blood cells. So if the chemotherapy takes their white blood cells down, this can boost them up so that they can keep taking the chemotherapy. And he's doing good and feeling good. And we talked about that story about the 103-year-old woman who's teaching yoga classes and taking ballroom dances. 103 years old. That's pretty amazing. Oh, yeah, it's not for everyone, for sure. Yeah, not everybody's going to want to do this type of lift. Not everybody wants to see it, but most people do. Most people want to avoid general anesthesia. And so as I was saying, she's 103 years old, and she said, they asked her what her secret is for living such a long, healthy life. And she said, every morning she gets up, she looks at the sun, and she says, today is going to be the best day of my entire life. And she says, and then it is. Now, I'll make stitches a little closer here. These are 2 millimeters across around the earlobe, because sometimes the earlobe can pull, and if you get a little separation, we can put more stitches in. But this way, we stay in good position. So she declares it's going to be the very best day of her entire life. And that is amazing. I started doing that myself, and I noticed when you declare it's going to be the best day of your life, when negative things or mediocre things happen, you immediately reframe them and say, well, this food may not have tasted as good, or they got my order wrong, or somebody scratched my car, or someone said something about me they didn't like, or my shoes scuffed, or I didn't get to buy the thing that I wanted to buy, or didn't get to go to this event, or spend the time with the person I wanted to. When those things happen, you say, well, but you know what? It's still the best day of my life. And it really changes how you feel. It changes your perspective. It changes how you walk into a room. The greatest day of my life ever. So thank you for being a part of the greatest day of my life and the greatest day of Nala's life. She's not going to forget today. And well, she may forget some of it while she's relaxing, but you're not going to forget the results. And we're very proud. We do 1 day, 1 week, 1 month follow-ups, and we take pictures at about 1 month. So that way you can see the results. There's a famous plastic surgery saying that after we do a cosmetic treatment, our vision gets better and our memory gets worse. And we say that because once you do a treatment, you are going to scrutinize yourself and look so closely at every little detail. Notice one brow's a little differently than the other, wrinkles more on one side than the other, usually more sun damage and wrinkles on, you can pull that suture away from where I'm stitching at things. More wrinkles on the left because when we drive, the sun comes through the driver's side. The vision gets better and the memory gets worse because we forget what we used to look like. And that's just common. It's human nature. That's why we show the before and after pictures so that people know. And sometimes I'll show them the pictures. They say, don't show me that picture again. Like, I don't want to see that. Everything's looking good. So we're stitching things up here. Now we are going to rebroadcast, so make sure you're following Image Lift on Facebook, Image Lift Now on Instagram, and Image Lift on YouTube because we will be rebroadcasting. Thank you for watching. Thank you for sharing. There'll be more videos coming soon. Nala, how are you feeling, dear?
Good.
Very good. Thank you for your comments, Doris. Okay, so you see that jawline there. So what I'm going to do is I'm just going to show you real briefly that that's her jawline there, but look at her neckline and jawline here where you can see what a difference it has made for us to tighten the neck and jawline there. So all done under local anesthesia.